Well, taking care of an elderly loved one can be challenging.
But there's support out there available to us. Joining us this morning to share some resources and information is Beverly Ruiz from Gilchrist. Welcome.
Thank you. Nice
We're very excited to have you. We all have aging parents and aging loved ones. And so this is a really important program. Tell us a little bit about it.
Sure. About 5 years ago, the geriatric practice at GBMC recognized the need to bring the care into the home. We were finding families were struggling to bring their loved ones in for office visits. And so we started the Elder Medical Care Program, originally to support our elders, where we put clinicians in the home to make home visits. So we have doctors and nurse practitioners who are making visits into the home to see those patients with chronic medical illnesses that are challenged to come into the office.
Wow, sounds great. So how do you know if your loved one needs or would benefit from elder care?
So if you have a loved one who is struggling with a chronic medical illness or complex medical issues and they're having a difficult time leaving the home, essentially they're home restricted, then this might be a program that can help them.
And so what kind of criteria would you need to be a part of this program?
So we're looking at patients with complex medical illnesses for which they find that treatment maybe is no longer effective, or they're stuck in the cycle of hospital, rehab, home, hospital, rehab, home. And so to break that cycle and bring the care into the home, we provide clinicians that go into the home to try to provide the care in place.
That is so important.
Yeah, it really is. So what about Medicare? Can we still receive Medicare home health services while under the elder medical care?
Absolutely. So our services are billed differently than skilling under the Part A benefit of Medicare, where the more traditional home health with the nurse, the physical therapist, occupational therapist, and home health aide are making visits. And so working with them, we can provide a more inclusive realm of care in the home for the patient.
Right. And I know that, like you mentioned, there's a cycle of home, hospital, rehab. So when we enroll in this program, or for our loved ones are enrolled, how often do they get to see their medical practitioners or anyone who comes to see them?
Well, we make visits as dictated really by what the patient needs. To keep in touch with them at least quarterly is a great idea to kind of stay on top of things as they're changing, but we do find this is a population where there are a lot of frequent changes, and so we will adapt our visits to meet the patient's needs.
Right, and you're going to be talking about this and so much more, right, in an upcoming lecture series?
Absolutely. So we will be at GBMC on October 8th, and we'll be talking more about primary care in the home.
This is life-changing for the entire family. Give us a little bit of information about where we can find all of that.
So this information you can call the main number to make a referral. It's the 888 number I think we have for folks to see, and then the information is on the screen too about the location at GBMC. It's Civiletti, and it's for Tuesday, October 8th.
That's wonderful. Thank you so much.
Thank you.
Thank you. Appreciate you being here.